Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. If as a pregnant woman you experience the slightest vaginal bleeding in pregnancy, your mind, by reflex, jumps to the worst case scenario. I understand that. It's alarming, it's unexpected, and it's very, very scary. It gives you this sense of immense helplessness as you turn to your doctor looking for an answer and a miracle to save the baby. Let's first try and understand what is the difference between spotting and bleeding, because this is again a very common question that patients ask me. Spotting is that blood which is visible on your, say, undergarment, underwear, or the toilet paper when you wipe after, say, urinating. Or it may appear as a light brown or pink spots, something that you might be used to seeing at the beginning or, say, the end of your periods, and that may or may not even require a pad or a liner. Bleeding, on the other hand, would be a brighter red. It's definitely more heavier than spotting. You could sort of compare it to your periods, and definitely requires a sanitary pad to manage. What we need to understand here is that every episode of bleeding does not always mean sinister things. About 30% of all pregnancies will experience spotting and bleeding in the first 3 months. IVF pregnancies, unfortunately, little more so. So let's discuss the first 6 common reasons for spotting or bleeding happening in the first trimester. Implantation bleeding. Implantation bleeding is usually light spotting or bleeding that occurs 6 to 12 days after conception. This happens when a fertilized egg begins dividing and forms an embryo, which then implants into the uterine wall. It is often one of the first signs of pregnancy and can occur even before a woman realizes she is pregnant. Needless to say, implantation bleeding is completely normal, harmless, and does not require any medical attention. Roughly 1/3 of pregnant women will experience this bleeding. It can often be confused with regular menstrual periods. It usually lasts from about few hours to about 3 days maximum. It is usually just light spotting and does not result in bleeding. It may be accompanied by other pregnancy symptoms like nausea, breast tenderness, and cramping, etc. And if this is followed by a positive test for pregnancy, then you know this is implantation bleeding and you know you're safe. So implantation bleeding is the first reason. Second reason, the second cause of bleeding that is obviously important because it is also common, is unfortunately miscarriage. Roughly 25% of all pregnancies will be lost, and 75% of them will be lost within the first 3 months of pregnancy. I'm not going to get into details of this right now because this will be the subject of a complete podcast, as there is so much to discuss. But in a nutshell, I will tell you that human fertility is defective, and it has been made so by nature so that our numbers don't increase exponentially. Thus, despite the mating of a healthy sperm and egg, it is possible that there are genetic defects in the embryo. This way, God keeps our fertility low. But to ensure that such an abnormal embryo does not result in an abnormal baby, God or nature has put some sensitive checks in our body which detects this abnormality and then doesn't allow the embryo to grow, and thus causing a miscarriage. The good part is that no future treatment is necessary for most cases, and subsequent pregnancy the next time will be absolutely normal. So when this happens, we tell our patients that, look, you just need to accept that probably if this pregnancy were allowed to grow, the baby would be abnormal. So in a way, one needs to be thankful that there was some abnormality and it's been taken care of. So coming to our point of discussion, if there is a miscarriage, the bleeding will be much heavier and accompanied by pain or abdominal cramps. Some women may experience a decrease in the pregnancy symptoms also. So if you are having nausea and vomiting and everything else, and suddenly after 2 days or 3 days or 1 week, all symptoms disappear, you do need to get in touch with your doctor. How do we diagnose if a miscarriage has happened? A. if the beta HCG is done and the levels are falling in repeated tests. If the beta HCG levels are falling, there is no other diagnosis but that the pregnancy has failed. B. If a scan has been done previously and a particular milestone was reached, and this time when you repeat the scan after an interval of say days or weeks, and the next milestone is not reached. For example, first we see a gestational sac, then we see a yolk sac, and then we see a heartbeat. So for example, if in the first scan a gestational sac was seen, and your doctor has called you back after a week and said, a yolk sac should be seen, but I'm sorry, we can't see a yolk sac. Maybe we wait for one more week and we say, even then the yolk sac is not seen. Or the yolk sac was seen, but the heartbeat is not seen. So if subsequent milestones are not reached in the time frame that they should, then we know also that this pregnancy is not working. Or C, if you do a scan and find that the baby's heartbeat, which was seen previously, is no longer present. So at 6 weeks you had done an ultrasound, you saw the baby's heartbeat, but unfortunately when you repeat the ultrasound at 7, 8, 9, 10, whatever weeks, and you find that the baby's heartbeat is no longer present. If unfortunately this does happen, you will need to speak to your doctor about the future course of action. So first reason, implantation bleeding. Second reason, miscarriage. 3. Ectopic pregnancy. This is a condition wherein the pregnancy or the embryo, instead of implanting inside the womb, gets stuck inside the fallopian tube or to the ovary. This is a very dangerous situation because these areas are not equipped to support the growing pregnancy, leading to rupture of the tube or bleeding from the tube or the ovary. There is no pregnancy inside the womb, yet there is some amount of bleeding, usually from it, may be accompanied by pain in the lower abdomen, sometimes very severe, and even fainting. Of course, this can happen because because of the bleeding, the hemoglobin is falling and you feel weak and faintish, but this is probably also a mechanism set by nature to warn us that something abnormal is happening, so that you inform your doctor and he or she takes corrective measures. I'm sorry to say, but this pregnancy can't be saved, but at least we can save your life to come back and fight another day. So point number 3, ectopic pregnancy. Point number 4, subchorionic hemorrhage or subchorionic hematoma or bleed is when blood collects between the placenta and the womb wall. So you have the baby, to the baby is attached to the placenta is attached to the womb wall. Even before the placenta forms, that part of the baby which is attached to the wall, if there is blood collection between this area and the womb wall, we call this a subchorionic hematoma. Obviously, common sense says this tends to separate the attachment of the growing fetus from the wall, creating a situation called threatened abortion. That is abortion that hasn't happened yet, but there is a threat of it. About 1% of all pregnancies and 10% of all IVF pregnancies will experience this phenomena. So we do see this a lot in our IVF centers. 20% of all women who bleed during the first 3 months will have this condition. I won't deny that this is a very scary situation where you have spotting or bleeding, and doing a scan, one sees a big clot sitting inside the womb. There are 3 things you need to remember at this point. A. In most cases, the clot inside will either get absorbed or come out in the form of vaginal bleeding, and the fetus will attach back securely. So which is why when patients have, say, a brown discharge, I tell them this is just collected blood coming from inside. It's a good thing because that blood has to come out for the baby to go back and attach once again. B. We need to definitely evaluate any possible reasons for miscarriage at this point and take corrective measures. I am not going to elaborate on this here, as this too is long enough for an entire podcast episode. C. This is one situation where bed rest for a short while may help, as it helps prevent the clot from dislodging or increasing. So it happens. It is not uncommon, especially in IVF centers, but usually resolves in most cases. 5th point, vanishing twin syndrome. Again, this is something that we see more in IVF centers or fertility clinics because twins usually happen more in fertility clinics. So this is a condition where twins have developed either spontaneously or as a result of infertility treatment like IUI or IVF, but probably one of the fetuses wasn't healthy and thus could not grow. The body preferentially chooses to abort this fetus in trying to save the other normal one. This may result in temporary spotting or bleeding till nature corrects things. The abnormal fetus will get absorbed into the mother's body without a trace, and the second baby continues healthy and without any complications. This is easily diagnosed by ultrasound first showing twins and then a repeat scan a few days or a few weeks later showing one healthy and the other one not seen. So again, one always needs to see a silver lining in whatever bad happens to you. So yes, we were very happy that a twin happened. We would have been very happy if the twins continued as well. But if the body understands something that we don't and says, I'm sorry, but this one baby is not so well, and if I try and save this one, I may compromise the other one as well. So let me preferentially let this baby go so that the other one survives. And that is what the body is doing, and we should be happy that we have one pregnancy which is healthy rather than two pregnancies of which one might be abnormal. And the sixth and the last point, sometimes we think of big issues and forget the small issues that may be the simple cause of our problems. I'm getting philosophical, eh? Yeah, but this is very true. There might be some minor issues like inflammation of the mouth of the womb, urine infections, or small grape-like polyps at the mouth of the womb, which are harmless but may lead to spotting or bleeding. I have often come across such patients where we keep searching for causes for the bleeding and then finally realize it was a local cause in the vagina. So whenever there is a problem like that, of course, doctors will do it, but you could probably ask a leading question to your doctor as well that, Doctor, could you just do a vaginal examination for me? Just in case the problem lies there. I've read it somewhere, I've heard it on a podcast and so on and so forth. So these were the causes for bleeding in the first trimester. Now, what do you do if you experience spotting or bleeding? 1. Rest in bed till you manage to contact your doctor. Most important. 2. Your doctor will decide which conditions are serious and which are not depending on your past history, your particular case and its associated complications and the severity of bleeding. 3. If the bleeding is heavy and you can't reach your doctor, go straight to the hospital where you're scheduled to deliver, or if you haven't booked yourself yet, go to the nearby hospital. 4. Sometimes doctors mention certain medicines in their initial prescriptions, medicines which are safe to use in an emergency if you have bleeding. You can take that medicine while you wait for a diagnosis and treatment or to get in touch with your doctor. Point number 5. Wear a pad so that you can monitor how much you bleed as well as what type of bleeding you are experiencing, so when you get in touch with your doctor, you can let him know. Point number 6. Do not use a tampon or introduce anything into the vaginal area if you are bleeding. Avoid sexual intercourse as well. Point number 7. Do not panic. Remember that in most instances the outcome is good. In fact, if a previous ultrasound has shown that the baby's heartbeat is present, then there is a 95% chance that all shall be well. Point number 8. Lastly, listen to and trust your doctor. He knows what is best for you and for your baby. So now we've understood why bleeding happens. We've now understood what do you need to do if you have spotting and bleeding. You've gone to your doctor, or you've got your relatives in the house, friends, etc. and everyone said, you must do a bed rest. So another burning question is whether bed rest helps if the patient is having spotting or bleeding, or if the patient has had a previous history of miscarriages. I'm sure all of you must have faced or heard of someone who has been put on bed rest for weeks, months, or sometimes the entire duration of pregnancy because of the reasons I have mentioned earlier. How much of real help does one gain? Is there evidence to support this practice, or is it just an additional torture on the woman and probably even her family? A practice which makes everyone from the patient to her doctor feel that they're doing something worthwhile to try and save the situation. Let's try and understand what happens if one does bed rest for weeks. 1. Pregnancy is a time when there is increased amount of clots forming inside the blood vessels of the body, because the blood is not moving too much, and pregnancy is a hypercoagulable state, so clots are more common, and these clots can be dangerous if they travel to the heart or the brain. By resting in bed, we are increasing the chances of such clots forming. Now, as Asians, we are lucky in not having an increased chances of these clots forming. But I'm sure when you travel abroad, you'll see all Caucasians, foreigners wearing these stockings and socks on flights, and all these advices that pregnant women must wear pressure bandages and stockings when they fly, and they must walk around, or oral contraceptive pills and smoking can be dangerous. These are more in Caucasians, I understand, but does not mean it can't happen in Asians at all. And by resting in bed, you're increasing your chances of these clots forming. So point number 1, more clots. Point number 2, 12% of muscle strength is lost with each week of bed rest. Thus, after weeks of rest, the pregnant woman will be quite incapable of holding herself up and will feel weak and tired and complain of aches and pains when she finally tries to walk. 3. Bed rest will also lead to loss of bone strength, and the bones would become hollower and more brittle. This is going to be further aggravated by pregnancy because of the increased calcium requirement, which is sometimes not met. Lastly, depression and a breakdown of the family structure. Being in bed all the time, away from friends, and sometimes even away from family in a hospital, being uncertain about the pregnancy, and sometimes really even feeling worthless because the woman feels that it's all her fault that all this is happening. I can only imagine what she must be having to go through being put through this bed rest. In today's medical world, treatments are based on research work done by millions of doctors across the world. We all submit our individual work online, and then there are others who combine all the researches and come out with collective data. So it's no longer, in my 20, 30, 40, 70 years of practice, this is what I've done, and that is why I feel this is what is correct. It is entirely evidence-based. Cochrane Library is one such body that collates data and is quite respected for that. Research over the years has shown that bed rest does not in any way prevent a miscarriage. It does not, and thus should not be advised. Having said that, there are some situations where bed rest for a short duration might help. Why so? As I said before, if there is a hematoma. So when bleeding happens, the body automatically tries to seal off the bleeding with a clot. But think of it logically, if we keep shaking or disturbing the clot, it will not settle down and keep breaking. Thus, in acute bleeding conditions, or if there is blood collected inside, like a hematoma, then bed rest just for a few days might help. In no time does the situation resolve, and then the lady can get up and go about her life again, including sitting on the floor, climbing stairs, and going out of the house as well. Now we've discussed the causes, what to do, what is spotting, what is bleeding, what do I do if I have, does bed rest help, etc., etc. Is there anything else special that I need to remember or I need to inform my doctor? Yes, you do. Something very, very important. An important reason to see the doctor in any type of bleeding is the condition called Rh incompatibility or Rh isoimmunization. So if a pregnant woman bleeds and her blood group is Rh negative and her husband's blood group is Rh positive, then the woman has the potential of developing antibodies. These antibodies will harm the baby in the next pregnancy if the baby has an Rh positive blood group. So say for example, you've had a spotting or bleeding in this pregnancy, and fortunately miscarriage has also not happened and the pregnancy has continued very nicely. And you say, okay, fine, everything is settled down, but you had an Rh negative blood group and your husband had Rh positive. Nothing will happen in this pregnancy. This baby is going to be safe. But when you get pregnant a second time, those antibodies which you created in the last pregnancy will cause problems to the baby. What problems? The baby can develop severe anemia, jaundice, brain damage, and heart failure. Rh incompatibility can be treated with injections of Rh immune globulin. Simply This is a simple injection which your doctor will administer if you have spotting or bleeding, even if you don't have a miscarriage, if he or she knows that you have Rh negative blood group. This medicine will prevent your body from creating Rh antibodies that will harm your baby. So please remember to have your blood group tested in the beginning of pregnancy itself and to inform your doctor in case it has slipped his mind. Lastly, one question which I am always asked by all my patients: if I experience bleeding during the first 3 months of pregnancy, could it hurt or harm the baby? Well, the answer is yes and no. Bleeding, as we have understood in the last couple of minutes, can be normal during these times and can be a sign of impending miscarriage. From that perspective, yes, it can be harmful. But if your concern is that if the pregnancy survives and everything becomes all right, will this bleeding harm my baby in the long run in terms of any developmental abnormalities or any structural abnormalities or genetic or mental abnormalities in the baby? The answer is a strict and confident no. The baby will be absolutely normal and safe, so do not worry about it. So, as you understand, in pregnancy, any kind of bleeding happening or any kind of problems happening is very scary. I understand that. But as we've understood in the last couple of minutes, most of these reasons are simple. Most of these reasons are correctable. Most often than not, no problem happens if you just listen to your doctor, take your medicines, and if for a short period of time you're advised bed rest, you do that. However, yes, there are certain conditions like an ectopic pregnancy which cannot be resolved, because of which you need to get in touch with your doctor on an immediate basis the moment you have a problem. And your doctor, remember, knows best. He cares for your baby more than anyone else does, and he or she is going to look after your baby the best he or she can. And I'm sure the outcome in most cases, in majority of the cases, will be brilliant. So, a very safe motherhood to you. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments, suggestions, and a 5-star rating. Looking forward to great interactions. Keep listening.